Is there a connection between intensive exercise and RMC? What do we know about the two?
Well, we made an observation many years ago, and this has been strengthened with data provided later on by Dr. Misao, my colleague, and team, our researchers. We made the initial observation that patients with RMC who came to us, while the vast majority were in their 20s, some were in their teens, some were in their 30s and 40s, and rarely older than 50. We observed that many of these young individuals were either athletes or served in the military. So that really raised the question, why is there a link between being athletic, serving in the military? Of course, we know boot camp, we know the intense, physical training that our men and women in the military go through. And Dr. Misao and his team and the research team we assembled to tackle this through looking at clinical data of patients, as well as going to the lab and doing experiments on mice. We came up with a link, a sort of a modifiable risk, if you will, that could be a factor in contributing factor, in addition to the sickle cell trait, that leads or contributes to the diagnosis, to the pathogenesis of RMC. But this is still, I would say, work in progress. I do not want people to take exercise, equate again, as we said, equate RMC and sickle cell trait, and do not want to equate exercise with development of RMC. But my message is, as is needed, as is well known for patients with sickle cell trait in general, you have patients with individuals with sickle cell trait have to be careful. Intense, strenuous exercise can lead to health problems unrelated to RMC, health problems. So it is important, in addition, as we recommend for individuals with sickle cell trait to stay well hydrated, to avoid extreme intense exercise. Again, also, it is advice that should be heeded for individual with sickle cell trait. Good hydration, avoid strenuous, extreme, intense exercise. But again, the activation tip here is stay well hydrated, get the information you need about the benefits of exercise. We do not want to say to individuals with sickle cell trait to not exercise at all, because there are advantages and benefits to staying physically active. But again, avoid the extreme strenuous exercises.